Africa's COVID-19 fatality rate is now higher than the global average. That's according to the Africa Centers for Disease Control and Prevention. The death rate on the continent now stands at 2.5%. That's against the global average of 2.2%. The announcement comes as the number of nations recording higher death rates continues to grow. In what seemed to be the second wave in Africa, 21 countries have recorded a death rate of above 3%. This news comes as prominent South African politician Jackson Mthembu died from coronavirus-related complications. A few days ago, he confirmed having tested positive for the virus via a tweet. He served as a minister and parliamentarian, as well as a high-ranking member of the African National Congress. Well, let's cross now to Dr. David Monaye. He's the director of the Center for African-China Studies at the University of Johannesburg. Dr. Monaye, thank you so much for your time. Now, Jackson Mthembu was one of the most recognizable South African leaders, having served in a very high-profile positions within the ANC, within Parliament, and the Office of the Presidency. Most recently, he was the public face of the country's COVID-19 response. How do you think he'll be remembered?
I think he's going to be remembered as a remarkable South African, a freedom fighter, a person that really loved his country and the African people, and really involved in global anti-apartheid on a number of other struggles, whether it's Western Sahara, Palestine, and other many areas. He will be remembered as a person who really played a critical role from Mandela presidency, President Mbeki, Zuma, and up to now to President Ramaphosa's cabinet. A central role as a minister in the presidency, coordinating the entire state, and at the forefront of the fight against COVID that unfortunately took his life.
Indeed. And of course, his passing just adds to a sadly growing list of public figures in Africa that have succumbed to the virus. We've seen a minister die in Malawi, another in Zimbabwe. Do you think we are starting to see that Africa is struggling to keep people alive? There are oxygen shortages across the continent, and of course, vaccines are still far away.
It's an unfortunate reality that as much as Africa has done extremely well in terms of delaying the process using basic methods of sanitizing, distancing, and all other protocols encouraged by World Health Organization, they've done extremely well. However, the second wave seemed to really deepening the crisis. I think compounding the situation is that most African countries do not have the capacity to handle the disease, do not have infrastructure, do not have resources to even queue for the vaccines that we see, unfortunately, developed countries hogging the space very selfishly, defending their own people at the expense of the poor, particularly on the African continent.
And of course, that is an issue that the WHO has highlighted this week, this failure of Western countries to cater for Africa. What do you think then needs to be done to ensure vaccines are made available to the continent as soon as possible, particularly as we see that death rates are indeed rising?
Africa, through the AU, I think, need to make a strong case at the level of World Health Organization, and especially with the developed countries, to really look this as a humanitarian disaster. And far beyond that, reach out to other important states in the world that are playing a critical role in this field, particularly Russia and China, and to ensure that Africa uses all vaccines without any geopolitics involved in the vaccine nationalism that is on the rise. Most of vaccines from the developed country are extremely expensive and complex to be managed on the African continent. Other than the one from Oxford in UK that is relatively cheap and easy to manage, I think the African continent could reach out to Russia and China to assist the continent before the situation gets worse.
Absolutely. Thank you so much, as always, for your insights. Dr. David Monaye joining us there from Johannesburg.